The COVID-19 pandemic has shown that an emergence of new disease is still considered problematic to human health and society. How comforting it would be to be able to predict the likelihood of the emergence of a disease in a particular individual and to warn them of a possible future health condition. Evolution is inevitable and unpredictable. Infections and viruses evolve rapidly and can become a burden of mortality and morbidity. Despite great advances in the diagnosis, treatment and prevention of infectious diseases, the emergence of new diseases is still a serious problem to the world population, and it underscores the need for more effective countermeasures. Obviously, rapid precision and analysis of relevant data is critical to minimizing the negative impact of viruses and diseases. Advances in artificial intelligence are helping us face this challenge. Not long ago, BionTech and InstaDeep developed an early warning system to identify new dangerous variants of coronavirus. The system has identified 12 of the 13 variants of the coronavirus identified by the World Health Organization as potentially dangerous. The system aims to identify potential high-risk variants to alert researchers, vaccine developers, authorities, and policymakers. This is actually really interesting because two modifications of the Omicron strain were identified by the system as potentially dangerous the same day its genetic sequence was first published. By analyzing several traits and assigning dangerous score to each of the viruses found, the system finds the most dangerous and malicious strains. Based on these scores, the strains are ranked. The strains with higher rank than other, those variants spread at the time are considered potentially dangerous variants. Such innovations can also be used to identify diseases in a particular individual. The strength of this approach is the use of a wide range of applications in healthcare that can predict the onset of disease and the stages of drug development. For example, last year Moscow clinics began using a program that analyzes patients' complaints and suggested to the doctor one of three diagnoses based on the International Disease Classification codes. The doctor can choose diagnosis suggested by the neural network, or make a decision herself if she sees that program is mistaken. Today, its accuracy rate is 68% when three diagnoses are suggested and 48% when one is suggested. The algorithm continues to learn from patient visits and its accuracy is gradually increasing. This is one shining example of how artificial intelligence is being implemented in medicine to detect local diseases. In addition to the ability to prevent the risk of disease, such system can predict the outcome of these diseases in a particular organism. For example, an international team of scientists and physicians from 20 hospitals around the world has developed an artificial intelligence model capable of predicting the outcome of coronavirus disease. The development project is called EXAM. For its training, the specialists used the data of more than 60,000 patients, and the information was depersonalized beforehand. Processing the data files took 2 weeks, and then EXAM was tested on 10,000 patients worldwide. And it was found that the model predicted either a required amount of oxygen or possible death with a sensitivity of 95%. Let us in the comments how do you feel about this kind of system determining your health status and predicting the likelihood of disease. Subscribe to the channel and check out our Instagram and TikTok pages as well.